If you are older and do not ejaculate, do so immediately. Urologist explains. Easy, humanly English. To all gentlemen tuning in, especially those of you navigating the vital stages of life, past 50, 60, and even beyond, if you've recently observed a notable shift in your most intimate moments, specifically experiencing the profound sensation of pleasure, that unmistakable zenith of climax, but now without the anticipated presence of seminal fluid, then I must impress upon you that this conversation holds truly essential significance. Perhaps this phenomenon occurred just a singular time, a surprising incident that instantaneously ignited a quiet but persistent knot of worry deep within your stomach. Or it could be a more enduring, silently recurring issue that you felt compelled to keep entirely to yourself, possibly wrestling with a nascent sense of shame or a quiet, gnawing fear about its potential implications for your overall health and well-being. I am Dr. Narita, a urologist with a focused and dedicated 12 years of clinical experience, specializing specifically in men's vital health across every single stage of life. And today, I feel it is imperative that we engage in a serious, yet profoundly supportive and understanding conversation, a dialogue designed to bring clarity and comfort where there might currently be confusion and apprehension. First, and truly of paramount importance, I want to convey to you unequivocally that I fully grasp the depth of your concern. The change you are beginning to notice within your body, this alteration in a deeply personal and often unspoken aspect of your physiology, is absolutely not a definitive sign that your masculinity has somehow expired, nor does it signal an irreversible end to your intimate life. Please, disabuse yourself of that notion immediately. Instead, I urge you to consider it from a different, far more empowering perspective. This is not a failure of any kind. Rather, it is best understood as a detailed and important message, a precise communication that your body is actively sending to you. And this vital message simply needs to be carefully and thoughtfully decoded. Please stay with me throughout this discussion because in the ensuing minutes, we are going to meticulously explore not only the surprising and often overlooked causes behind this phenomenon, but also the critical warning signs that demand your attention. Most importantly, we will delve into the clear, actionable, and entirely manageable solutions that modern medicine now robustly offers, all designed to restore your peace of mind, rekindle your confidence, and enhance your overall well-being. Before we delve deeply into the specifics of what transpires when seminal fluid is conspicuously absent, let's take a moment for a brief, yet highly illustrative, non-textbook examination of how this intricate biological process should function under normal, healthy circumstances. I invite you to conceptualize your body's reproductive system as an exquisitely tuned, perfectly timed orchestral ensemble. In this sophisticated biological symphony, each component plays a distinct and crucial instrument, contributing harmoniously to the grand finale of ejaculation. At the heart of this intricate system, the testicles diligently perform their foundational task, the continuous production of sperm, the very microscopic seeds of life. These spermatozoa, once matured, embark on a remarkable journey through a complex network of tiny tubes. Concurrently, the seminal vesicles, two small glandular structures nestled behind the bladder, contribute the lion's share, the very bulk of the seminal fluid. This fluid is far from merely a carrier. It is a rich, viscous, and profoundly nourishing medium, abundant in fructose, meticulously designed to provide essential energy and robust protection for the sperm as they navigate their arduous path. Simultaneously, the prostate gland, a walnut-sized organ strategically positioned just below the bladder, adds its own critical component, a milky, slightly acidic fluid that plays a vital role in enhancing sperm motility and further safeguarding them within the diverse environment of the female reproductive tract. This carefully orchestrated cocktail, comprising sperm, the nourishing fluid from the seminal vesicles, and the protective fluid from the prostate, is then meticulously gathered and precisely prepared within the urethra, the singular channel that extends through the penis, serving as the ultimate exit pathway. When the moments of climax arrive, a specific and powerful set of muscles, strategically located around the base of the penis and within the pelvic floor, contract in a rapid, forceful, and exquisitely rhythmic sequence. This powerful muscular action serves to propel that fluid mixture forward and outward. It is a remarkably rapid and fluid event, the magnificent culmination of delicate, synchronized timing between a vast network of nerves, specialized glands, and powerful muscles, all working in seamless concert. Now, here presents a profoundly crucial distinction, gentlemen, one that is often misunderstood or conflated. Climax and ejaculation are fundamentally not the same physiological event. While they are intimately linked and typically occur in tandem, their underlying mechanisms are quite distinct. Climax or orgasm is primarily a neurological sensation, a subjective experience of intense pleasure and release, profoundly governed by the intricate workings of your brain and its vast, complex nervous system. It is a feeling, a peak of sensory experience. Ejaculation, in contrast, is the physical, mechanical act of expelling the fluid from the body. For the vast majority of your life, these two distinct events happen so seamlessly as one unified experience that it becomes nearly impossible to differentiate them in your conscious perception. However, it is vital to understand that they are driven by separate, albeit interconnected, physiological mechanisms. Our precise focus today, and the specific concern we are addressing, is centered squarely on dry ejaculation. This is the accurate technical medical term for the situation where a man reaches the peak of sexual arousal, experiencing that characteristic, deeply felt pleasure and the full neurological sensation of orgasm, but then notices that little to no seminal fluid is actually released from the penis. In my office, patients frequently describe this experience using phrases like an empty orgasm or a pleasurable but unfulfilling release. This perceptible gap, this disconcerting disconnect between the long-standing expectation of a physical outcome and the new, stark reality of its absence, understandably fuels a significant amount of worry and anxiety. And I absolutely understand why this would be so. For decades, you have instinctively expected a tangible, physical sign to accompany and confirm the event of climax, an outward manifestation of an inner process. However, it is fundamentally vital to grasp this crucial point. Your inherent ability to feel pleasure, to experience the profound sensations of intimacy, can remain entirely intact, continuing to be governed perfectly by the intricate network of your nerves and the complex processing of your brain. The significant change we are discussing lies specifically within the mechanical delivery system itself, the plumbing, if you will. This absence of fluid emphatically does not signify that you have somehow lost your virility, your intrinsic masculinity, or your capacity for sexual gratification. It simply and scientifically means that a specific part of your body's intricate plumbing system now has a particular, often identifiable and treatable reason for this observed change. Just a quick, appreciative pause before we proceed to meticulously enumerate the main causes of dry ejaculation. If you are finding this information helpful, enlightening, or reassuring in any way, I would be deeply grateful if you would consider hitting that like button. It's a simple yet powerful action that signals to YouTube algorithms that this video contains valuable information and deserves to reach a wider audience of men who might be facing similar concerns. Furthermore, I wholeheartedly invite you to subscribe to my channel and join our rapidly growing community, a brotherhood of men committed to understanding and prioritizing their health. And finally, please consider dropping a comment below. I genuinely love to hear from you. Tell me where in the world you are watching from. It's incredibly inspiring and heartwarming for me to witness this supportive brotherhood of men connecting and supporting each other across vast continents and diverse cultures, united by a shared commitment to vital health. Now, let's methodically break down the three most common and primary causes of dry ejaculation, unraveling the biological and practical aspects of each. Knowing the specific why behind what you are experiencing is not just academically interesting. It is often the very first, most empowering step towards regaining a profound sense of control and understanding over your own body and health. The first and most frequently encountered cause is commonly known as retrograde ejaculation, a condition where the gatekeeper is too relaxed. To fully comprehend the biology of retrograde ejaculation, picture in your mind a small yet crucially important muscular valve. This valve acts much like a gatekeeper, strategically positioned at the internal exit of your bladder, precisely where it connects to the urethra. Under normal physiological circumstances, during the moments leading up to and during climax, this internal bladder neck sphincter, our gatekeeper, should firmly and efficiently clamp down. This tightening action is absolutely essential because it ensures that the seminal fluid, once propelled from the various glands, has only one clear, unobstructed path to follow, forward and out through the urethra. However, in cases of retrograde ejaculation, this gatekeeper valve is either too relaxed, too weak, or simply fails to contract adequately. Consequently, the seminal fluid, always following the path of least resistance, flows backward. Instead of exiting the body, it takes an alternative route, retreating into the bladder, where it then mixes with your urine. You, as the individual, will still experience the full neurological pleasure and sensation of climax. Your brain and nerves are functioning perfectly, but because the fluid does not exit externally, the physical act feels noticeably dry, leading to the experience of an empty orgasm. The practical clue that often signals retrograde ejaculation is quite distinctive and, importantly, usually non-alarming. Many men, after an episode of dry ejaculation, will notice that their urine appears somewhat cloudier or contains small gelatinous particles immediately after intimacy. This is simply because the seminal fluid, having flowed backward into the bladder, is now mixing with the urine and is subsequently expelled during urination. It's a straightforward physical confirmation of the retrograde flow. The practical causes for this phenomenon are varied, but often specific. Retrograde ejaculation commonly occurs as an aftermath of certain surgical procedures performed on the prostate or bladder. For instance, transurethral resection of the prostate, TURP, a common and highly effective surgery for an enlarged prostate, benign prostatic hyperplasia or BPH, or other bladder neck surgeries, while entirely successful and medically necessary for their intended purpose, can inadvertently affect the delicate nerves and muscle fibers that control the bladder neck sphincter. The integrity of the gatekeeper is compromised. It is also a well-documented and recognized side effect of specific medications. These primarily include alpha blockers, drugs frequently prescribed to treat conditions such as high blood pressure, hypertension, or, very commonly, an enlarged prostate. While these medicines effectively work by relaxing smooth muscles in the blood vessels or prostate to ease urine flow, they can also, as an unintended consequence, relax that tiny muscular gatekeeper at the bladder neck, leading to the backward flow of semen. I vividly recall a patient, a man of immense pride and dignity, who was utterly distraught after undergoing a highly successful prostate surgery that had significantly improved his urinary symptoms. His distress was palpable when he experienced dry ejaculations. However, when I carefully explained that this was purely a mechanical alteration, akin to a traffic light being stuck open, a simple plumbing issue, and that his underlying desire, his ability to achieve erections, and his capacity to feel the profound pleasure of climax were completely unaffected, an immense wave of relief washed over him. His masculinity remained intact. It was merely a change in the physical delivery system. Our second major cause where the plumbing is blocked is known as duct obstruction. To understand the biology of duct obstruction, consider this. The the testicles are still diligently producing sperm, and the seminal vesicles, along with the prostate and other accessory glands, are still producing their respective fluids normally. The factory is operational, manufacturing all the necessary components. However, think of the small, delicate ducts, particularly the ejaculatory ducts, which are formed by the union of the vas deferens and seminal vesicles, as the intricate delivery pipes within your plumbing system. If these vital pipes become partially or completely blocked, the delivery vehicle, the seminal fluid carrying the sperm, simply cannot pass through effectively. The volume of ejaculate will drastically decrease or even disappear entirely, even though the internal production of all the components is absolutely fine. It's like having a perfectly good water supply at the source, but a kink or blockage in the hose prevents the water from reaching the nozzle. The practical causes for these internal blockages can be diverse. One common culprit is the scarring that can be left behind by past infections, particularly severe or untreated cases of prostatitis, inflammation of the prostate gland, epididymitis, inflammation of the epididymis, or even certain sexually transmitted infections, STIs. These infections, if left to fester, can lead to fibrotic tissue formation, effectively narrowing or completely obstructing the delicate ducts. Less commonly, small calcifications, akin to tiny stones or concretions, can form within the seminal vesicles or ejaculatory ducts themselves, acting as physical impediments to the flow. These seminal calculi, though rare, can effectively block the passage, much like a pebble in a pipe. The practical signs or symptoms of duct obstruction can sometimes be subtle, making diagnosis a bit more challenging. However, some men report experiencing a new or uncharacteristic mild discomfort or a dull ache in the pelvis, often localized in the perineum or suprapubic area, particularly during or immediately after climax. This discomfort can arise from the buildup of pressure behind the obstruction as the body attempts to expel the fluid. Additionally, men might have noticed a gradual, progressive change over a longer period. The seminal fluid has become noticeably thicker, perhaps even more gel-like, and significantly less abundant than it once was. This change reflects the struggle of the system to push fluid through a narrowed pathway, or the complete absence of fluid if the blockage is total. The excellent news regarding duct obstructions is that many of these blockages are, in fact, highly treatable and often reversible. Treatment frequently involves medication, such as antibiotics to clear any underlying infection that might be causing inflammation and scarring, or anti-inflammatory drugs to reduce swelling. If medication proves insufficient, or if the obstruction is purely anatomical, minimally invasive surgical procedures, such as transurethral resection of the ejaculatory ducts, TURED, can be performed to carefully clear the blockage and restore the normal, unimpeded flow of seminal fluid. Our third major area of investigation points to hormonal factors, particularly when the fuel is low, specifically referring to low testosterone levels. To delve into the biology of this cause, it's critical to understand that testosterone is far more than just the primary driver of libido or a regulator of sperm production. It is the fundamental fuel, the crucial anabolic hormone for the entire male reproductive system. Its influence extends deeply into the optimal functioning and health of the prostate, and critically, the seminal vesicles, those glands that, as we discussed, contribute the vast bulk of the seminal fluid. Testosterone plays a vital role in maintaining the structural integrity and secretory capacity of these glands. It influences the volume, consistency, and chemical composition of the fluid they produce. Therefore, when testosterone levels drop significantly below the healthy physiological range, the entire intricate reproductive system, from a functional standpoint, begins to slow down and operate suboptimally. The glands may not produce as much fluid, or the quality of the fluid may be compromised. The emotional impact and broader systemic signs of low testosterone are significant and far-reaching. Initially, you might indeed notice a reduction in the sheer volume of seminal fluid during ejaculation. However, over a more extended period, this hormonal deficiency, medically termed hypogonadism, can manifest in a cascade of other broader symptoms. These often include a noticeable decrease in libido, a diminished sex drive that impacts desire for intimacy, erections that are less firm or less reliable than they once were, and a generally less intense, more muted sensation of climax. Beyond the sexual sphere, men frequently experience a pervasive and unexplained fatigue, a distinct lack of energy that daily tasks feel arduous. Mood changes, ranging from increased irritability to feelings of sadness or even clinical depression, are also common. Physical changes can include a noticeable loss of muscle mass, a decrease in strength, and an unwelcome increase in body fat, particularly around the abdomen. On a cognitive level, many men report a brain fog or difficulty concentrating. These systemic effects underscore that low testosterone impacts more than just sexual function. It profoundly influences a man's overall vitality and quality of life. The practical solution for low testosterone is thankfully well established and often highly effective. Hypogonadism, a treatable hormonal deficiency, can be definitively diagnosed through simple blood tests that measure circulating testosterone levels. To get an accurate baseline, these tests are often performed in the morning when testosterone levels are typically at their peak and may be repeated to confirm the diagnosis. If the deficiency is confirmed, carefully managed hormone replacement therapy, HRT, typically in the form of testosterone replacement therapy, TRT, can be a transformative intervention. TRT can be administered through various methods, including injections, topical gels, patches, or subcutaneous pellets, all tailored to the individual's needs and preferences. Under the watchful eye and careful monitoring of a urologist or endocrinologist, TRT can often restore not only better seminal fluid production and improved ejaculatory volume, but also significantly boost energy levels, rekindle desire, enhance erectile function, improve mood, and restore a man's overall quality of life. It is a profound mistake, and one that I see too often, to simply chalk this up to getting old and dismiss these symptoms as an inevitable consequence of aging. While testosterone levels do naturally decline with age, a deficiency that causes such significant symptoms warrants proper medical investigation and, if appropriate, treatment. While the causes we have just discussed are, most of the time, manageable and often treatable conditions. As your dedicated doctor, I have an unwavering responsibility to also address the critical exceptions. It is imperative to understand that dry ejaculation, though often benign, can sometimes serve as an urgent red flag, signaling a more serious underlying medical condition that demands immediate attention. This is precisely why paying meticulous attention to any accompanying symptoms is absolutely crucial for your health and safety. When should you see me or another urologist? Immediately, without delay. If dry ejaculation appears suddenly and without any clear or obvious explanation, particularly if this change is accompanied by other distressing symptoms, do not hesitate. These accompanying signals are potent indicators that require an urgent urological evaluation. Such warning signs include experiencing pain, whether it's localized discomfort during climax, testicular pain, or pelvic pain that is new and persistent, the presence of blood in your urine, hematuria, or, even more specifically, blood in your seminal fluid, hematospermia, which is always a cause for concern, a sudden, unexplained fever, which could indicate a systemic infection or inflammation, or most critically, a loss of sensation in the genital area, which points towards potential neurological compromise. Any combination of these symptoms with dry ejaculation is a serious signal that must not be ignored or postponed. Underlying conditions that can interfere with the intricate plumbing or nerve signals leading to dry ejaculation include certain neurological diseases, such as Parkinson's disease, which can disrupt the autonomic nervous system controlling bladder-neck function. Uncontrolled and long-standing diabetes, particularly if blood sugar levels have been poorly managed for an extended period, can lead to diabetic neuropathy, damaging the nerves responsible for proper bladder-neck closure and ejaculatory reflexes. In very rare but critical cases, specific urological cancers, such as prostate cancer, bladder cancer, or seminal vesicle tumors, can physically obstruct the ejaculatory ducts or invade the nerves, interfering with the normal ejaculatory process. These are not intended to create undue alarm, but to underscore the importance of prompt investigation when red flags are present. Beyond the purely physical manifestations and medical diagnoses, we simply cannot and must not ignore the profound emotional toll that dry ejaculation can inflict upon a man. The emotional impact is unequivocally real and often deeply felt. For many men, the tangible presence of seminal fluid during ejaculation is intrinsically, if often subconsciously, equated with their performance, their potency, and indeed, their very sense of virility and masculinity. When this expected physical manifestation disappears, a complex and distressing array of emotions can take root. Feelings of inadequacy, a diminished sense of self-worth, anxiety about future intimate encounters, and pervasive frustration with one's own body are all remarkably common. It is tragically common for men to begin consciously or subconsciously avoiding intimacy altogether, driven by a deep-seated fear of being judged by their partner, or perhaps even more profoundly, by a personal feeling of being incomplete or somehow broken. This avoidance can then strain relationships, leading to further isolation and distress. The emotional reassurance, therefore, becomes paramount. The single most important and empowering step towards breaking this potentially vicious cycle of worry and avoidance is accurate information combined with open, honest communication. Understanding unequivocally that this is a physiological change, a medical alteration within the body's systems, and not a personal failure, a defect of character, or a sign of lost manhood, can immediately lift an enormous, crushing weight from a man's shoulders. Your intrinsic ability to feel pleasure, your capacity to achieve erections, and your profound ability to enjoy meaningful connection and intimacy with your partner remain, in the vast majority of cases, entirely intact and robust. This shift in understanding paves the way for a healthier perspective and encourages proactive steps towards resolution. Ultimately, gentlemen, this journey of understanding your body is one of empowerment. Dry ejaculation, while a surprising and often concerning change, is not a sentence. It is a symptom, a message that your body is communicating to you, inviting you to listen and respond. Whether it stems from a common mechanical issue like retrograde ejaculation, a blockage in the delicate plumbing, or an underlying hormonal imbalance, modern urology offers clear diagnostic pathways and effective treatments. Do not let shame or fear dictate your health decisions. Instead, choose knowledge and proactive care. By seeking professional guidance from a urologist, you are not admitting defeat. You are taking a powerful, courageous step towards reclaiming your peace of mind, restoring your confidence, and ensuring your overall well-being and satisfaction in all aspects of life, including your most intimate moments. This conversation is not about defining your masculinity by a single bodily function, but about understanding and nurturing your entire health.